Hello, everybody. We're just gonna, it looks like we're just kind of getting people into the webinar, and so we'll just give it a couple of minutes to get everybody settled, and then we'll get started here in just a couple minutes. It looks like our numbers have kind of flattened, so we'll go ahead and get started. Good morning, everybody. I'm Molly Duplashane. I'm the Deputy Director of the Department of Excise and Licenses and the Office of Marijuana Policy. So thanks for joining us this morning. I'm going to hand it over to Ashley in a minute, and we'll let the rest of the team introduce themselves as well. And we're going to go through our presentation from kind of start to finish. And then we'll leave some time for some public comment at the end. And I guess after Ashley gets started and after we introduce ourselves, I'll go through how that's going to work a little bit. But you want to introduce yourself, Ashley, and get us started?
Sure. Hi, everyone. I'm Ashley Kilroy. I'm the Executive Director of the Department of Excise and Licenses, and also the Office of Marijuana Policy, which is housed in Excise and Licenses. So thanks for being here today. We're really excited to share with you this package of legislative changes that we've put together. And we're going to be, moving through council with them, hopefully by the end of next month or maybe mid next month. And we really are excited to hear your feedback and your input. I think really when we think about these changes that are coming, it will be some of the most meaningful growth we've seen in the industry, providing additional, lines and areas of opportunity for access and consumption, and allow entrepreneurs to expand their profiles, expand their business. At the same time, we've overlaid our equity program over all of these licenses, and the team will dive into those details with you. But I think it's really something, after everything that we've heard and talked to everyone about, that really has risen to the forefront as not just a value of our city, of Denver and of Mayor Hancock's, but also really of all of you and all of you on this call and everybody in the industry and all of our stakeholders. Really, everyone has embraced this idea. At the same time, as we're moving forward, really allowing an expansion of the footprint of the industry, we're also ensuring that as we do that, we maintain the strong protections that we've had in place for our youth, for our community, for neighborhoods, and also now, because we'll be talking about delivery, for delivery drivers. So thank you for everything. Thanks for your input today. And I think I haven't looked to see who's on this call yet, but our work group was great. We had a huge, diverse group of people on the work group, and I hope some of you are here too, and that we have a lot of different interests represented. And then Abby, why don't you introduce yourself, and we can kind of go around the Hollywood squares and just introductions.
Good morning, everyone. I'm Abby Borchers. I'm a policy analyst with Excise and Licenses.
I'm Erica Rogers. I'm also a policy analyst with Excise and Licenses.
I'm Joey Pena. I'm a cannabis process navigator for Excise and Licenses.
I'm Reggie Newline. I'm with the Denver City Attorney's Office.
All right, thanks everybody. And so just a couple of things of how we're going to run the show today. So like I said, we're going to go through a presentation. It's the one that was posted online and that was sent out with the bulletin. And we'll kind of go from that to start to finish. But as we're going along, if you have comment, you can use the raise hand feature, and then we'll get you in the queue for public comment at the end. We'll allow 2 minutes per person during public comment. We do have the Q&A turned on for today, and so if you have a clarifying question that you would like, you can put that in the Q&A, and we'll try to address it. If there's other ones that aren't, you can also put public comment in the Q&A as well. And then if there are other questions that we can't get to today necessarily in the Q&A, we will be compiling all those questions in combination with the ones that we also received at the session on Tuesday, and we'll be posting those sometime next week. So feel free to use that option and let us know if you have a question or raise your hand for a public comment. So you want to go ahead and get the slideshow started, Abby? Okay, you can go ahead to the next one. So why are we here today? So this has been really something that we have been talking about for several years now. And so this is the culmination of several years of outreach and research and work that we've been doing. And so we want to provide you with an opportunity to review this comprehensive package of legislative changes to our city's marijuana ordinances. And then after this process, this kind of phase of stakeholder outreach, we'll be proposing and presenting this information to City Council. We really want to provide this opportunity for community participation and public feedback on this draft ordinance language. And so while we've, this is informed, where we're at right now has already been informed by a lot of input and stakeholder outreach, we still want to, make sure we're hearing from everybody that we possibly can. So that's really what today's session is about and what this phase is about before we bring it forward to City Council. So Ashley mentioned this a little bit at the beginning, but just to reiterate a little bit, really at the core and at the center of everything that we've been talking about and at the center of what we've been proposing is we've tried to maintain that lens on equity. And so that's really overlapping everything that we've been discussing, and really it's the core of the proposal today. At the same time, we want to meet the needs of the residents and the businesses and the visitors in Denver. We also want to make sure that what we're implementing is responsible and operational. And then we also want to ensure the health, safety, and well-being of our city. So with that equity lens really at the center, some of the goals that we had in mind were also to provide new ownership opportunities and make sure that we're providing those opportunities for innovation, expansion, and creativity for our entrepreneurs here in Denver. We want to identify new consumer opportunities for access and responsible use for adults over 21. We also really hold strong the value of maintaining those strong protections in place for youth and neighborhoods. That is something that Denver has really become known for, and we want to be able to maintain that, as well as continue that community investment through our marijuana tax dollars. The next slide, Abby. Hopefully I'm not, there we go, thank you.
Okay.
So I won't say, I don't think I'll, oh, sorry.
Wait, should I go back one?
You could, yeah, just quickly, I'll just mention.
Okay.
Are we on?
So we were here.
The legislative summary, is this one before the executive summary? Sorry, I don't have the presentation.
So it's executive summary and then the legislation summary.
Yeah, so if you can just go to the executive summary one real quick.
Yep.
Sorry. Okay, so what I was just going to say is I don't think we'll go through this slide in detail because there's really information about this slide in all the slides that are coming up, and there's a slide about each one of these bullet points here. But this is really just for your reference and to refer back to, and if you want the 30,000 level view of the proposal, this is a great place to come back to. But this is kind of like our elevator speech regarding the proposal. So just really something to refer back to if you're looking for that. Go ahead, Abby, sorry.
Do you see the legislation summary up now?
Not yet. I don't know if I'm on a lag. Oh, there you go.
Okay.
There you go. Okay, so this is the legislation summary. The proposal that we have today, there's a lot of different pieces and parts to it, but what it boils down to is it's all kind of culminates into 3 separate bills. The first one is an omnibus bill, which includes the topics of social equity, some changes to our existing license structure, as well as the creation of the marijuana delivery program. Really, this is to align also with the state changes that were made a couple of years ago through their sunset bill. So this is the one, it's kind of, bits and pieces of a lot of different changes. But it combines all of those all together in one bill. Separately, there's a bill on the marijuana hospitality program, which is the first bill that creates the program and allows us to opt into those consumption establishments that were created by the state. And then finally, there'll be a bill to repeal the cannabis consumption pilot program, which was a citizen-initiated ordinance in 2016, and that's after enactment of the more robust hospitality program if bill number 2 passes. Go ahead, Abby.
I think we might have a little bit of a lag.
Okay. I can start talking about the next slide. So we'll see if it pops up. So the next slide is, and hopefully the rest of you can see it, and maybe it's just me that's on a lag. But this is just a timeline of kind of how things have evolved in Denver for marijuana policy since 2010. In 2010, Denver began licensing medical marijuana businesses in Denver. 4 years later is when we began licensing retail marijuana businesses in Denver. That initial launch of retail marijuana included a transition phase, which allowed only previously existing medical businesses to add or convert retail. And so that lasted for about 2 years until in 2016, that transition phase ended. And the city council actually adopted a permanent moratorium on certain medical marijuana businesses. And then they created a citywide cap on other types of retail marijuana businesses. So they created a citywide cap on retail stores and grows. So that has really been the model, the framework that we've been operating under since 2016. In 2018, Mayor Hancock attended the U.S. Conference of Mayors, and a lot of the conversations that were occurring there were around social equity in the cannabis policies. And so he came back from that conference and talked to Ashley and talked to our Office of Marijuana Policy and really asked us to dig into this a little bit more and develop a plan to address equity within the cannabis industry. And that was a range of things from both to how we license cannabis businesses as well as looking at expungements. So we launched into those efforts and really started looking at them throughout 2018 and 2019. And then in 2019, during the state legislative session, several changes were made to state laws, including that sunset bill that I referred to, as well as the authorization of new license types, including delivery, hospitality, and the accelerator license. Meanwhile, at the beginning of this year, in early 2020, we were able to calculate and publish the cap that was set in 2016. So that happened early this year. We released information and published what those caps were for the stores and the grows. And then we asked City Council to postpone the lottery for the distribution of those licenses underneath that cap, really so that we could allow for this process that we've just gone through to occur, and that we could be here where we are now, which is to present a comprehensive proposal for how to incorporate a social equity program into the issuance of those new licenses, as well as the licenses that were under the cap. So that's where we're at today, and we're here to propose that package of bills, including the equity licensing, aligning with the state, and authorizing delivery and hospitality. You want to go to the next one, Abby? So on the next slide, around stakeholder outreach and legislative preparation, as I said, really, we've been talking about this for several years. In 2018 and 19, we started doing research. We started learning more about what other cities and states are doing when it comes to social equity in the cannabis industry. So we were monitoring those programs. We had some informal outreach, and we made sure that this was just a conversation we were having with all of our stakeholders and our interested parties. We also organized and participated in several discussions on this. We included over the last couple of years some panels on social equity in our Denver Marijuana Management Symposium. We participated in the MED rulemaking work groups on the accelerator license, and then again this year on the changes under Bill 1424. And then we also participated in the Black Cannabis Equity Initiative podcast. Anytime we could be out learning and talking about this and hearing from other people, we were trying to take the opportunity. At the same time, we wanted to get a little bit of data around this. And so in 2019, we conducted a cannabis business and opportunity study. And that included several methods of reaching out and gathering information to inform this study. We conducted key informant interviews, we held stakeholder sessions and public forums, and we held an online survey which got 316 respondents. And so that was able to really, again, inform the work that we were able to start at the beginning of 2020. And then in May of 2020, we created a diverse work group that met 5 times. It was made up of social equity experts, Denver lawmakers, city and state regulatory agency representatives, law enforcement, marijuana business industry representatives, delivery industry representatives. And so we met twice in May, twice in June, and then again in September, and really went through each one of these topics and into detail, and took feedback on the various proposals and the various options within each of them. Each meeting included an opportunity for public comment and written comment, and all of them are still on our website and posted publicly, both the agendas and the recordings of the meetings and the minutes. And that's really what got us to where we are today. So at this point, I think I will be passing it over to Erica to walk through the first part, which is the omnibus bill.
Thank you, Molly. Abby, if you want to hop in, we'll get started. So as Molly mentioned, there will be 3 different bills, and they'll contain different things. The omnibus bill is the largest bill. It has the most substantive changes. It's a total rewrite. So just highlighting high level what it does. As Ashley and Molly have mentioned, equity is such a huge focus. So this bill revises our Denver Marijuana Code using an equity lens, creating opportunities for social equity applicants within the ordinance itself. That's the first and foremost thing. Another big thing that the bill does is it aligns Denver with the state Colorado Marijuana Code and rules, both in format and content where possible. So we'll talk a little bit about that. Another key change is that it does reimagine that license distribution. As Molly mentioned, the cap and lottery have been with us since 2016. And while we have not held a lottery to date, we are looking to replace the cap and the lottery requirements with a different kind of program for distributing license types, which is exclusivity for our social equity applicants. The last thing this bill does is it authorizes delivery in Denver and lays out the delivery program where our applicants in Denver can get a delivery permit under the state rules. So going high level, why is equity such a huge focus, especially in marijuana regulation? Most of you on this call are probably familiar with the war on drugs and the policy that began in the 1970s. Congress passed the Controlled Substance Act outlawing cannabis and other drugs in the United States, and the president at the time declared drug abuse public enemy #1. This wasn't just something that was talked about, it was something that a lot of money was put into. In 1986, the Anti-Drug Abuse Act allocated almost $2 billion to drug law enforcement and established some standards in criminal justice that we've been researching for decades, such as mandatory minimums in drug offenses. What we've learned since studying those public policies starting in the 70s, we've learned from criminal justice data and research that those arrests and convictions for drug offenses have an overwhelmingly negative impact on the person who is arrested or convicted. Those negative impacts include negative economic, educational, health-related opportunities, holding people back, things like that overwhelmingly. In addition to those negative effects, research has shown that those drug policies have been enforced in a discriminatory manner, meaning that negative impacts of those law enforcement have a disproportionate impact on distinct communities, such as communities of color and communities that have been more acutely targeted for drug crimes based on other characteristics. So what are our goals for focusing on equity in marijuana regulation? We want to provide opportunities to individuals who have been harmed by that marijuana prohibition, by historical inequities, by discriminatory law enforcement. And we want to lay the foundation for equitable wealth creation, because we know this has been a problem, not just in Denver, not in Colorado, but nationwide. And so as most of you on this call know, this is a problem that many jurisdictions are addressing. So what were the impacts of early marijuana regulation and early marijuana policy? These kind of play into our discussion about equity as well. So when marijuana was first legalized, federal law necessitated strict regulations. So because it was illegal at the federal level and for the first time legal at the state level, there needed to be strict regulations in place, which drove up the need for applicants and entrants into the market to access significant technical expertise. So the use of consultants, architects, attorneys, professional services that cost a lot of money. Another barrier to entry was that initial laws that legalized cannabis created no specific provisions for these types of equity discussions that we're having today. I think that the topic at the time was that legalization was considered the next step in equity at the time. And so that created a barrier to entry. Another barrier was that individuals with convictions were not allowed to work in the industry and not allowed to have ownership here in Colorado. Finally, requirements for vertical integration and property acquisition and lease requirements added to the high entry costs in addition to the expertise. So when we talk about using an equity lens to assess our code, and what do we mean by that? This is a phrase that is used throughout the city by the mayor, by a lot of departments, looking at things through an equity lens. And so we often get the question, what does that mean? What it means is that while we're making decisions and while we're having conversations about different policies to pursue, we're asking questions about that policy to come to the best solution and best proposal. Some of the questions include who will benefit from the decision? What are the associated burdens or unintentional impacts on a given demographic? What are the disparities addressed by the decision? And how can we document our action steps to correct any burden of unintentional impact connected to the key decisions? So just so you all know, these are kind of the questions that are typically used throughout the city, but especially by our department when we were looking at these policies to see how they would impact our community members. So with that, let's dive into the specifics of the equity program we're proposing in the omnibus bill. First, we want to look at who will qualify as a social equity applicant. So who is the person who's going to benefit from the program? What we're proposing is that Denver adopt the same definition as the state of Colorado. The state did a lot of research on, who should qualify as an equity applicant. So, but the state has defined a social equity applicant as a Colorado resident who either on their own or with a group of other social equity applicants owns at least 51% of a proposed marijuana business and has not in the past been subjected to disciplinary action by a licensing authority that would have resulted in that license being taken away. And then they have to meet one of the three criteria in that middle column there. So the first criteria deals with where the person lived, either in an opportunity zone or a disproportionate impacted area, which is defined as you can see on the right. The second way somebody could qualify is whether they or their immediate family member was arrested, convicted, or suffered civil asset forfeiture due to a marijuana offense, some of those effects of the war on drugs that we talked about. And then the third way an applicant could qualify is if their household income did not exceed 50% of the state median income. So There's a couple different ways that an applicant could be qualified as a social equity applicant, all addressing some of those harms that we discussed. The next question is, what opportunities exist for social equity applicants? So once somebody is determined that to be a social equity applicant, they have the opportunity to take advantage of three different things in our omnibus bill. So the first and biggest is the exclusive licensing period for most of our license types: stores, cultivations, transporters, manufacturing, and then the new permits or the new licenses: hospitality, mobile, and hospitality and sales. We're going to have this exclusivity period for 6 years, using 6 as the baseline because we legalized recreational marijuana in 2014. So existing industry members have had 6 years to, establish themselves, to grow, to really, secure their place in the industry. And we want to give that same opportunity to social equity applicants. The next piece is that we're going to offer exclusive ability to conduct deliveries to transporter licensees. This is important because at the state level, the state has said that both stores and transporters are eligible for delivery permits. In Denver, we will still require the stores, and whether medical or retail, to get a delivery permit to provide the product. However, to conduct those deliveries, we're going to limit that to transporter licensees for 3 years. There will be a review period after 2 years to report to City Council on the effects of the program, the success, how it's doing, make recommendations before that period ends. But after that 3 years, stores would then also be able to conduct deliveries. This will give social equity applicants a real opportunity to create a name for themselves, to establish their businesses in this area, and having stores and centers who are existing, requiring them to contract with a social equity applicant, transporter licensee, will foster those relationships and give those social equity applicants opportunities. Finally, the other big thing that we are offering to social equity applicants is reduced fees. We've heard over and over again that access to capital is a huge barrier to entry into the marijuana industry, especially for social equity applicants. So one way that the department will be helping social equity applicants financially is to cover half of the cost of application and license fees for stores, transporters, cultivations, and MIPS. In addition, we will, in the hospitality bill, we'll be having lower licensing fees for that new license type, as well as the delivery permit. Some other ways that we wanted to let you know that we'll be supporting our social equity applicants. You may not see these explicitly stated in the bill language. However, we wanted you to know that these are things we're working on. The first is that the omnibus bill does allow for local market entry through the state accelerator program. So that is one way for social equity applicants to establish their business. We will also be continuing our process navigation and creating social equity applicant centered guidance. We recognize that many of our social equity applicants, this may be their first interaction with the city agency, it may be their first interaction with excise and licenses, and it may be their first time starting a business. So we want to make sure that our resources are geared toward those applicants who, maybe need a little extra help or aren't sure where to start because they haven't done it before. Hand in hand with that, we'd love to partner with marijuana industry associations and law firms. We've already talked about and discussed the facilitation of workshops, classes, business development support, ways to really provide that education to our social equity applicants, again, who maybe need a little extra help as they've never done this before. In addition, we are continuing our conversations about other ways to provide financial support. We're in conversations with our economic development office here in Denver to explore the creation of a local grant or loan program. We are also interested to see what opportunities may exist through state funding. So in addition to the reduced fees, we're continuing our conversations about other ways outside of our department that we can help advocate for social equity applicants to receive financial support. So that's the overview of the equity-specific program. Next, I'll jump into other changes in the new marijuana code. So some of the basics, as I mentioned, we will be aligning with the state and following suit. We will be moving all of the medical marijuana provisions from Chapter 24 into Chapter 6, where the retail provisions are already located. Just like the state condensed the medical and the retail code into one code, we are looking to similarly streamline. We'll also be adopting some consistent terminology to help readers and applicants see the consistencies between state law and local law. So some of that parallel terminology includes using the term medical and retail stores as opposed to medical marijuana centers and retail marijuana stores. The other changes you'll see that we'll kind of talk about provisions that govern existing licenses. We've kind of evaluated some of our longstanding provisions to see how we can make them more equitable. So we'll kind of go through some of the following slides about the tweaks that we're making. The first set of provisions we'll talk about are the youth protection regulations. These fall into three different buckets, three different ways that we can influence and protect youth perceptions and youth usage to ensure that the legal marijuana industry in Denver is serving everybody. So when it comes to advertising, we are going to, in Denver, maintain our current advertising restrictions, and that includes not opting into the state's expansion on branding. Last year, the state adopted an exemption for outdoor advertising on branding. It's a strong Denver value to limit that outdoor advertising. So as noted by the little star here, we do intend to align with the state where possible, but in the areas like this where it's a strong Denver value, we do have a little bit different of a provision. The next area that has youth protection regulations is when it comes to density. So this has to deal with the clustering of how close marijuana outlets are to each other. We are going to maintain our prohibition on new store or cultivation locations, whether that's a brand new license or a transferred license, in our top 5 most saturated neighborhoods. This is currently existing in the code, and we do want to keep that provision. We're also going to keep the provision that allows the director to consider density either when issuing or denying a license through the public hearing process. Finally, we will be maintaining that 1,000-foot buffer between stores. So nothing changing here. When it comes to proximity, this is a little different than density. It has to deal with not how close the outlets are to each other, but how close they are to other things. Most of you are familiar with these proximity restrictions, from schools and city-owned rec centers, things like that. We will be maintaining our current proximity restrictions for all license types. However, we will be adjusting the method for measuring proximity from certain locations, such as drug and alcohol treatment facilities, city recreation centers, and outdoor pools. The reason for this is that we noticed that across the city, the size of a property where those types of facilities were located differed based on whether that area of town was more dense or whether it was more spread out. So certain areas of the city were receiving more protection than others based on the size of the land where these facilities were located. So that was something we sought to equalize when we updated the bill. So that will hopefully free up more property, more area for social equity applicants to locate and to spread out more evenly across the city. Next, we'll talk about the cap and lottery. Most of you are probably familiar with these mechanisms, but just as a refresher, the cap is a maximum number of locations that can exist in the city for retail marijuana stores or cultivations. The formula for calculating those caps was put in ordinance, and earlier this year, the department released those numbers, both the cap on stores, the cap on cultivations, and then also that cumulative cap. Once those caps have been calculated, the ordinance currently requires the director to hold a lottery as the method for distribution of new store or cultivation licenses up to that eligible number of locations. That's where that protection in code is currently given for the top 5 most saturated neighborhoods. So what we are proposing is to remove the cap, remove those numbers, eliminate the lottery process as the way to distribute new licenses, but keep that protection for saturated neighborhoods. So when the cap was initially passed, It was intended to protect communities from oversaturation, which is a goal that we agree with. But in looking at how the things have changed and the landscape has changed over the past 5 years, we see that the cap actually exacerbates inequities that are present in the zoning code, and that results in a scarce number of available locations and drives up the cost of licenses. By removing the cap, we hope to open up the opportunity for more people to apply. By eliminating the lottery, which was intended to level the playing field at the time it was adopted, it leaves everything to chance. There are onerous requirements to enter the lottery. Once you're in the lottery, you're not guaranteed to get a license. And so it doesn't really help our social equity applicants because it still leaves it to chance. What we're hoping to do is replace it with something that gives the social equity applicants more of a fair start. If they apply, if they meet the requirements, they can get a license. We've also seen that other jurisdictions that have implemented a lottery system, for example, in Illinois, have faced legal challenges, which delay the distribution of licenses. It delays the program, and ultimately it's equity applicants who bear the burden, who have to pay the cost for those delays. So we don't want to do that. Now, in the protections that exist for the 5 most saturated neighborhoods, the current cap and lottery provisions applies to new stores and cultivation locations that would be created and distributed through the lottery. However, in our proposal, we want to maintain that protection not just for new stores and cultivations, but for also transfers of location into any of those 5 most saturated neighborhoods. And in the event of a tie, we will be protecting more neighborhoods rather than fewer. Another key piece of the omnibus bill is improving aspects of our public licensure process. So as many of you know, some of the types of licenses have to go through the public hearing process. One of the proposals that we are putting forth in the bill is to require what is called a social impact plan, as opposed to a community engagement plan. This is something we piloted with our research and development license that passed earlier this year. We think that beefing up the community engagement plan to include additional information about diversity and inclusion in hiring and employment, as well as environmental sustainability, and of course, the existing standards in the community engagement plan for how that licensee plans to engage with their RNOs and fellow businesses in the community. What we're proposing is that social impact plan be publicly available. And then each year on renewal, the businesses report on how they did on their goals. This isn't going to be something that affects the department's decision on whether to renew or deny. However, it will provide information to the community members where that business is located so that they can better weigh in during the public licensure process and the needs and desires hearing. The next thing that we will be doing is requiring that evidence of community support for hospitality licenses. This is a feature that we're carrying over from the existing DCA license that was passed by Citizen Initiative. We think that it encourages applicants to talk to the neighborhoods where they want to locate and foster those positive relationships so that the licensure process can go smoothly. Excuse me, sorry. Finally, we're looking at updating our hearing process so that if no filed opposition is received to a license application, we are looking to expedite that license application for a docket style hearing. So we're hoping that what that will do is reduce the time and resources needed by a social equity applicant to get through that public hearing process. Last slide for me. So some other changes you'll see in the omnibus bill include aligning our hours of operation for stores with the state hours of operation. So previously in Denver, or I guess currently in Denver, it is 8 a.m. to 10 p.m. But we are proposing that that stores be allowed to operate from 8 a.m. until midnight. We've heard from DPD that there isn't a super huge concern with burglaries, as most of them happen in the wee hours anyway. But it does create more flexibility and opportunity for our social equity applicant licensees and existing licensees who may want to offer those extended hours. In tandem with that, we will also be adding a safety requirement that we've seen successful in Aurora, and that's requiring stores to remove their product from the sales floor at night and secure it either in a safe or vault. Like I said, the city of Aurora has passed this and reported success as a way to prevent burglaries. And we thought it would be good to include, especially as we're seeing new applicants come on board. They've already got enough to deal with. Another key change you'll see in the omnibus bill is that application requirements are going to be minimized in ordinance. That doesn't mean they're going away. It just means that as the department learns and adapts to the needs of the types of paperwork or documents that social equity applicants may have and may need to submit, we can adjust those without going to council to have those requirements changed. This is something that we're looking at doing across license types. We've started to do it in other licensing ordinances. So this is a department-wide goal. Finally, some fee changes to account for the work that our amazing team does processing applications. We are looking to increase some of the fees for the types of changes to licenses. So transfer of location, modification of premise, and transfer of ownership. For the transfer of location, we will be differentiating between the fees for an applicant who requires a hearing for that transfer and those applicants who do not. So with that, that's all I have on the omnibus. I will kick it to Abby to talk about the last key piece of that bill, which is delivery.
Okay, thanks, Erica. I'm going to run through some of the high-level details of what we're proposing for Denver's delivery program. So for some background, in 2019, the State General Assembly passed a bill that allows for marijuana delivery to consumers' homes. That bill allows for medical and retail marijuana stores to obtain delivery permits, as well as medical and retail marijuana transporters to obtain delivery permits, and allows stores to conduct deliveries to consumers, as well as transporters to contract with stores that have delivery permits and conduct deliveries on behalf of those stores. So what we're proposing in Denver is that from July 1, 2021 until July 1, 2024, so a period of 3 years, only transporters may conduct deliveries on behalf of stores. And those transporters must qualify as a social equity applicant and obtain a delivery permit from Denver. So that means that stores that supply marijuana to consumers through transporters will need to get a delivery permit, but would not be able to do their own deliveries until July 1, 2024. And then after July 1, 2024, both transporters and stores may conduct deliveries. Who can receive deliveries? Pursuant to state law, a customer or patient must be 21 or older to receive deliveries. Deliveries can occur from 8 a.m. until midnight. This is in alignment with state law. And the amount of product that can be delivered is in alignment with the amount of product that can be purchased when you walk into a store. So for medical, that's 2 ounces of marijuana, 40 grams of concentrate, and marijuana products containing up to 20,000 milligrams of THC. And for retail, it's 1 ounce of marijuana, 8 grams of concentrate, and products containing up to 800 milligrams of THC. Delivery drivers are required to check a consumer's ID before transferring marijuana to them. And in addition, we are proposing requiring delivery drivers to use ID scanners to verify a consumer's age. All legal forms of payment are acceptable, including online payment. Additionally, we would require delivery drivers or prohibit delivery drivers from accepting cash tips. Both the requirement to use an ID scanner as well as the prohibition on cash tips are just additional safeguards to protect against the risk of diversion of marijuana to youth. So state rule lays out some security and safety requirements that we would also align with. Video surveillance must record at least the front view of the vehicle as well as the secure storage compartment that holds the marijuana deliveries. And that footage has to be retained for a minimum of 40 days, which is in alignment with requirements for stores. Enclosed delivery vehicles, so a van or a truck, cannot contain more than $10,000 in retail value of marijuana, and non-enclosed delivery vehicles cannot contain more than $2,000 in retail value of marijuana. In addition, Denver would require that delivery drivers keep receipts in the vehicle that show the retail value of each delivery order in the vehicle. That's so that law enforcement has a tool they can use to verify the amount of marijuana in the vehicle and its retail value. So marijuana could be delivered to any private residence located in Denver or any private residence in another Colorado jurisdiction, as long as that jurisdiction has affirmatively allowed for marijuana delivery and has not prohibited deliveries into the jurisdiction from outside. Marijuana delivery is prohibited within any Colorado jurisdiction that has not affirmatively opted into delivery, as well as any premises located at a school, a college campus, located on public property, or any commercial property unit, such as offices or retail space. Delivery is also prohibited to any consumer or private residence where the licensee knows or reasonably should know that the consumer or private residence already received a delivery that same business day. This is similar to what's called looping protections in retail marijuana stores and medical marijuana centers, that's meant to prohibit people from ordering large amounts of marijuana over the course of multiple transactions. Additionally, Denver would prohibit delivery to a drug or alcohol treatment facility. This is just an additional location that we would prohibit delivery to align with our proximity restrictions, which also protect drug and alcohol treatment facilities. And then these are our proposed fees for delivery permits. An application fee, which is a one-time fee, is $1,000. The annual license fee is $2,000, and then $1,000 for a transfer of location and $250 for a transfer of ownership. And I will kick it back to Molly to discuss hospitality.
All right, thanks, Abby and Erica. So last section of the bill, and then we'll get into some public comment. If you want to go, thank you. So this last bill has, or the second to last, has to do with establishing marijuana hospitality businesses in Denver. So we're going to, in alignment with the state's hospitality license, this bill will be creating the Denver Marijuana Hospitality Program to allow for lawful consumption of marijuana with smoking and vaping options. At the same time, we wanted to maintain those strong youth protections to minimize risks associated with marijuana legalization. Some history of this piece of marijuana policy in Denver over the last couple of years. I think I mentioned most of this before, but in 2016, Denver residents approved the Denver Cannabis Consumption Pilot Program. It was a citizen-initiated ordinance. It was often referred to as I-300, and it passed in the fall of 2016. Throughout 2017 or into the summer of 2017, the Department of Excise and Licenses adopted agency rules that supplemented the citizen-initiated ordinance, and I believe we started taking applications in that summer. And in 2018, the first cannabis consumption license was issued to allow for adult consumption within a designated consumption area. And then in 2019, House Bill 19-1230 passed, which created two types of marijuana hospitality licenses at the state level. So many of the restrictions and limitations that were within the cannabis consumption pilot, because of some state level limitations, are no longer there in this new marijuana hospitality model passed at the state. Also in 2019, the Colorado Marijuana Enforcement Division adopted some agency rules to supplement that statute. So now we kind of have the full package of what we'd be able to adopt here in Denver. The state bill created basically three different types of models. Two of them are under the marijuana hospitality license model, and then one of them is under the marijuana hospitality and sales establishment. The marijuana hospitality establishment allows for consumption of marijuana in a permanently licensed premise. So it's a brick and mortar type location, and there's no sales of marijuana permitted. So it's a bring your own model at those hospitality establishments. that model was probably the most similar to our existing designated consumption license that we have right now. Under that same hospitality license model, there's also an option for a mobile licensed premise. So it must be a vehicle like a shuttle or a bus, but again, still no sales of marijuana would be permitted. So it would still be a bring your own model. However, there is this third option, which does allow for sales of marijuana. It's limited sales, a smaller amount of sales than what would be allowed in a store or in a medical or retail store. But it does allow for consumption of that marijuana that is purchased on site at a permanently licensed premise to be purchased and consumed at the same location. And then the bring your own model is not permitted at these types of locations. So some basics around this type of license, who can go to a hospitality establishment. They must be 21 and older in order to enter all types of hospitality establishments. That applies for both types of hospitality as well as hospitality and sales. They can operate between the hours of 7 a.m. and 2 a.m. Again, that's for all types of hospitality establishments. And that is actually, and both of those are set by the state and we're aligning with them. And the 7 a.m. to 2 a.m. Is also the same as what our current designated consumption license allows for as well. Something that was interesting about the state hospitality model is that it does allow local jurisdictions to opt into an exemption from the Colorado Clean Indoor Air Act for consumption of marijuana indoors by both smoking and vaping. And so this is something that we are proposing, is that indoor smoking and vaping of marijuana only would be allowed at all types of establishments. The only caveat is that they will be required to have proper odor and ventilation controls in order to mitigate any community nuisances with possible odors, as well as health hazards with ventilation controls. And then additionally, LPG torches and butane lighters are prohibited at all types of hospitality establishments, which aligns with our currently designated consumption area license. A couple of more local hospitality establishment requirements are that in Denver, all types of hospitality establishments are permitted from allowing their licensed premise to overlap with a licensed premise of a medical or retail store. And so in a hospitality and sales location, they would have to be at a different location than a medical and marijuana store. For just a hospitality, they would be able to, it just requires that they have like a different separate ingress and egress in a different suite or unit. And then same goes pretty much for liquor stores as well. As I mentioned before, an odor control plan will be required for all types of hospitality establishments. And then also applicants for a hospitality license must have a needs and desires hearing and establish that there is a need and a desire for that type of business in where they're applying to locate. The only caveat there is that unless it is a mobile hospitality establishment, and then it would not require to go through a needs and desires hearing as long as there is not a permanently licensed establishment that goes with it. And in that case, it would still be a hospitality license and then would need a needs and desires hearing. So a couple of more site-specific requirements. The first in regards to an outdoor consumption area. This is allowed by the state, and so we'll be aligning with that. And there's just a requirement that they have to be surrounded by a site obscuring wall, fence, or hedge, or other type of opaque or translucent barrier. And again, they have to make sure that they're complying with Denver's odor control requirements and ventilation requirements. And so we'll be working through that. We haven't had an outdoor consumption area yet. And so working through what some of those odor control requirements might be to make sure that the surrounding community isn't impacted by an outdoor consumption area. Retail food establishments would also be allowed to have a hospitality establishment co-located. Per state rules, they just have to be separated from the rest of the retail food establishment by a site obscuring barrier and secure door. marijuana cannot be added to the food that is served within the retail food establishment, so they have to be separated. And then still, again, they must comply with Denver odor control and ventilation requirements as well. Okay, so as we mentioned before, youth protection is another one of our key values when we're developing marijuana policy. And so we are proposing to maintain the location and proximity requirements for hospitality businesses that are currently existing for our designated consumption area licenses. So those include to be 1,000 feet from schools, childcare facilities, city pools and rec centers, and alcohol and drug treatment facilities, with city pools and rec centers and drug treatment facilities having that change that Erica referenced with how they're measured from the site of the business to the pool and the rec center or the drug and alcohol treatment facility, where we would be measuring to the actual building or the area where the pool and the rec center are rather than to the land. Additionally, we're proposing that they be required to be 1,000 feet from other hospitality businesses, similar to how marijuana stores are required to be 1,000 feet from other stores. A key to that is because the hospitality and sales establishments will have that sales component. So we wanted to align them with the requirements for stores and centers. For mobile hospitality establishments, the state requires that they have GPS tracking of the mobile premise, and that each route is logged according to their standard operating procedures. And so we'll be aligning with that requirement as well. And then one additional requirement is that they'll also have to supply Denver with the route information that they'll be using of where their stops and their starts and their loading and unloading will be occurring. They're also prohibited from allowing consumption if a vehicle is stopped at any given location for more than 30 minutes. And so again, they'll have to provide that route information, including where they'll be stopping and the time of that stop. For hospitality and sales establishments, we are proposing aligning with the state. No changes there from what they've allowed as far as 2 grams of marijuana, a half a gram of marijuana concentrate, and then marijuana products containing 20 milligrams of THC or less. So that would be allowed at the hospitality and sales establishment. And then finally on this piece, the proposed license fees closely align with what we have for the designated consumption license right now. And it's $1,000 for an application fee, which is a one-time application fee, and then $2,000 for the annual licensing fee. $1,500 for a transfer of location, unless it is a mobile, because that one doesn't require a needs and desires hearing. But if it has a needs and desires hearing, the transfer of location fee would be $1,500, $250 for transfer of ownership, and $300 for modification of premise. And then finally, the last and third bill that we would be proposing would be to repeal the designated consumption area license. And so we would repeal that ordinance after enactment of the Denver Marijuana Hospitality Program. And that is just to make sure it's clear that we only have one program on the books rather than these 2 different ones. And we think that the hospitality program is a much more robust business option. And so we would remove this one from the books after adding the hospitality licenses. As a part of that, we would establish that currently licensed designated consumption licenses that were licensed as of November 1st will automatically convert to a hospitality license. And those that are converted, that's okay. Those that are converted would be required to either have a permanent premise or a mobile vehicle premise. It would have to be like a hospitality, not a hospitality and sales. So I'll just walk through quickly a couple of our next steps now that we're into this phase. Again, our legislation is broken down into 3 different bills. All of those are linked on our website. We just learned that the links that were provided in the bulletin broke because we actually did a website transition. The city converted to a new website management platform over the last couple of days. And so it sounds like the bulletin links are not working. So we'll get an updated bulletin sent out, but those draft bills are still posted on our website and are still available for review. The timeline for each of them are that we hope to enter into the legislative phase in the first quarter of next year. And then there will be some implementation time that we'll need for several pieces of these, but we do hope to start taking applications for marijuana hospitality and marijuana delivery, the new licenses, in Q3 of next year. We also know and recognize that we want to be measuring our successes and tracking how this proposal and this implementation is going. And so we're working through some of those pieces right now as far as what type of data we'll be able to track so that we can be able to tell if our social equity program is, helping the people we intend it to and having the successes that we're hoping, that we're looking for. And so we'll be tracking key information as that program is implemented. Additionally, under the omnibus bill, it does require that we report out to City Council on the delivery program prior to the sunset. So that exclusivity period for transporters to deliver, it does require that 2 years in, we report out to City Council to let them know how that is going before we make any changes. And then finally, as Erica mentioned, the social impact plans will be another tool that we'll be able to have to track and measure the success of not only the work that the city is doing, but the industry as well. And so with those social impact plans becoming public and having more aspects that we'll be looking at, then that'll be an additional tool that we'll be able to use to track and measure as well. So just some comments on additional stakeholder outreach. We had the session on Tuesday and this one this morning, and we're happy to keep taking additional feedback as well. I think we're going to put another community stakeholder session an evening time. We'll probably do that the first or second week in January. So if you have others that weren't able to attend either today or on Tuesday and still want to hear this presentation and provide some feedback, that early January time will be an additional opportunity. And then we'll also keep taking written comments. There's a template provided on our website for your convenience. It's not a requirement to use that template, but it just is an easy way to kind of organize the feedback. You can also at any time send an email to marijuanainfo@denvergov.org to request a meeting or to learn more or provide feedback. We're always here, and this is really what, as I said at the beginning, this is really what this phase is about, is taking your feedback and seeing anywhere where we just need to make some tweaks or changes. And the only other thing I'd say on that last slide was just if you have a group that you want us to come and talk to, not just a meeting, but if there's a group you want us to come and present to, we're happy to do that as well. So I think now we can jump into the public comment section. And so I don't know if you're able to see, Abby, or if you can tell us how many people we have signed up, or if anybody's hands are raised. It doesn't look like we have any hands raised right now.
No one has raised their hand, but if anybody would like to make a public comment, please feel free to raise your hand and I'll promote you to a panelist, which will temporarily kick you out of the meeting and then bring you back as a panelist. So there might be a little bit of a lag between when I promote you to panelist and when you can actually speak, but that gives you the ability to unmute yourself and then use video. So we have some.
And I would just say, as you come in as a panelist and are able to speak, just make sure, we had some issues with mute and unmute the other day. So just make sure you're unmuted and we can hear you before you start speaking.
Okay. First, we have Jarrell Wall. So I am promoting you to a panelist.
I am unmuted now, I believe. Hey, how you guys doing? I'm actually very much impressed with what's going on with some of the omnibus laws here. I'm just kind of curious when it comes to the buffer zones. I think when it comes to social consumption early on with the sunset law, that was kind of a sticking point that was making it a little bit difficult for people to actually get those licenses and things like that. So I'm kind of wondering what the thinking was when it comes to, hospitality and why we still have the 1,000-foot buffer zones and why it's not one-to-one with liquor licenses.
Hey, Jarrell, this is Ashley. Thanks for asking that question. So as you can see, all of this stuff related to marijuana, we have to balance public health, safety, the industry concerns, our neighborhood concerns, youth protections. And so going through this, when we first did, and that was I-300 with the DCAs, when we first did that, we had some really robust feedback from doctors, from healthcare providers, from hospitals, from public health officials, from human services, from safety departments about the importance of the proximity restrictions from prohibited areas. And a lot of other jurisdictions do this. And in fact, our regulations, our prohibitions, I think Joey has compared them across the country. Ours are probably a little less restrictive than other jurisdictions. So we made that decision about 2 years ago, really based on, protections of youth. And now we kind of fast forward 2 years later, and we still have those concerns about protections of youth. But what we found from talking to some industry members and real estate experts is now with COVID, there's significantly more commercial property available. So 2 years ago, when we fell on the side of keeping the youth protections in place, and there was, some concern about not as much access or not as much commercial property available, now we've got a lot more available. And we've heard from a lot of industry members, they'll say, oh, there's a Burger King down the corner that's now available, or there's a old restaurant in my neighborhood that's now available. So we don't see that as being as big of a concern in the past. And also doing some of the research we've looked at, we've seen things such as, no matter what type of industry you're in or what type of business you're opening, you're going to have some proximity issues or some kind of concerns about where you locate. If you're a lawyer, maybe you're going to want to make sure you're near the courthouse. If you're opening a gas station or a 7-Eleven, you might want to be near a busy intersection. So a lot of businesses have to, you might have a whole group of commercial real estate available that may or may not suit your needs, but then you might be limited by your particular business. So we've decided, as part of opening and expanding this industry, that we ensure that we are maintaining those area restrictions and protect our youth.
I definitely understand that. And I understand, you have to be a little more pragmatic when it comes to starting this. But again, I just like to push back, especially when it comes to, I see Voodoo Ranger commercials everywhere nowadays. And it's when it comes to advertising, and, we have Market Street with liquor businesses everywhere. So again, I like to just make sure that we keep that in mind when we think about, marijuana consumption businesses and whatnot being 1,000 parts from each other and 1,000 feet from liquor businesses and things like that. So I definitely appreciate it. And again, I'm very impressed with what you guys have presented today in terms of hospitality and in terms of social equity.
Great. Thanks for your comments, Jarrell. Thank you.
Okay, next is Shannon Fender. Shannon, I'm promoting you to a panelist.
Hi, guys. Thank you so much. Appreciate the time this morning. I had a few questions. I was hoping I could answer or ask them one at a time and allow you the time to answer instead of just throwing them all at you.
So I think we're trying to limit this to public comment right now. We have about 55 people in the meeting. So do you have one or two, or do you want to make public comments and we can get back to you if we have time at the end?
Sure. Okay. I will put them as comment then. Okay. So, I think that we have heard consistently in the conversations that transpired over the summer and the work that we're doing at the state that access to capital is the #1 thing that social equity licensees need. And yet this proposal does everything but that. And, we as Native Roots put forward some recommendations. I believe the Color of Cannabis put forward some recommendations. I believe MIG did as well. And it really doesn't seem like much was incorporated. So I'm just kind of curious what Denver's plan is, and if Denver would be willing to utilize lobbying resources during the legislative session to help assist us in what we're doing as industry and private groups with the state to actually get some funding that could be utilized for grant programs. We really need some support there. And since Denver hasn't incorporated anything in its own budget, I think that it would be really helpful if you could help us out up at the legislature next year. I would also ask, it does seem like there's a pretty significant carve out for the R&D license and not being a social equity license, and would just be curious about what the perspective is on that, since there is such a heavy emphasis to prioritize social equity, except for this one license opportunity. I have a request out to you all to provide some more information on like a red line version of the bill. It seems like there's some changes that aren't really related to delivery or hospitality. Well, the hospitality is separate already, but there seems to be more changes in the omnibus that we were kind of catching, but we have no way without literally reading the bills next to each other. So something that could really highlight every single change that was made would be really helpful if there isn't a red line. And then finally, we've been speaking about this for over a year. The bill on delivery did allow and did intend for patients to be able to have access immediately. When we began conversations with some council members earlier this year about getting patient access immediately, we were asked to stop and to wait for EXL's process. And obviously COVID has thrown us all for a wrench. And I do understand that there's been some delay, but it really is just disappointing to see patients being put out again all the way until Q3 of next year. You can apply for, and transporters can apply for, stores and transporters on January 2nd of this year, a permit to begin deliveries. And we would ask that patients be able to receive deliveries immediately starting in January. And that, understanding the retail is a bigger scheme and a bigger rollout, but that we really shouldn't be politicizing the patient access issue, especially during COVID. So I think that I'll stop there, and I've probably gone over my time, but that's the feedback that I have so far. Thank you.
Thanks, Shannon. And let's get through some of the questions, some of the comments, and see if we have time to kind of come back and hit on some of those, or we can also talk to you offline at a later date. So sorry, Molly, for interrupting.
Okay, next is Logan Goolsby. Logan, I'm promoting you to a panelist. Wait, where did Logan go? Okay, Logan disappeared from the queue. So, oh, there he is. Okay, promoting you to a panelist. Logan, you might be muted.
There we go. Can you hear me now?
Yes.
Great. So thank you for taking my questions. I've got really two questions right now. The first is that when you're looking at social equity components, I notice a lot of that is Colorado based, and a lot of lower income individuals have to move around, or if they're in positions such as military positions where they don't often meet those, the income of the state, right? They're transferred between different states. And I'm wondering if E&L is going to look at the scope of that 15-year period, not just within the scope within Colorado, but within other states, in the opportunities that people have had outside of Colorado, or lack of opportunities outside of Colorado.
So I feel bad. I told Shannon we weren't going to answer her questions at this point. But if you don't mind, Logan, unless we have a quick answer to that, can we just note that and see if we get back to you after we hear all the public comment?
Absolutely. So that's my first comment, I guess. And then my second comment would be looking at the transfer of ownerships. I'm wondering if, and I'm going to just make a comment, if the transfer of ownership for these new licenses would should stay within social equity applicants rather than allowing someone behind the scenes, paying a social equity applicant to apply for a license, receive one, and then transfer it to, another another investor. So I think that would be my two comments on that.
Thank you, Logan. Let me see, Abby, how many hands up do we have?
We have 4 hands up right now and 48 people in the meeting.
Okay, so Molly, do you think we could try to maybe answer Logan's questions and go back to Shannon's, or would you like to keep getting through the questions, the comments?
I think that it would actually benefit to answer a couple of them because I think they're pretty short and quick answers. So I can walk through both of Logan's, I think, pretty quickly, and I think a couple of Shannon's can be answered pretty quickly too. So Logan, the social equity applicant criteria for the location of where they've lived, if they've lived in a disproportionate impact area, we'll be relying on the state criteria for that, and I believe they'll be looking at anywhere within those census tract areas, and it doesn't have to necessarily be only Colorado. But again, that'd be an MED clarification that I would recommend. And then as far as the transfer of ownership, if a social equity applicant gets a license and they want to transfer ownership, we chose not to put limitations on that. Existing industry members were able to have that opportunity to sell or transfer their license over the last 6 years. And so we didn't want to limit that opportunity for social equity applicants if they got into it and a year later decided they wanted to sell their license. And so that is an opportunity that social equity applicants would be able to have as well.
Great, thank you very much.
Okay, next. Oh, did you want to go back to Shannon?
You're on mute, Molly.
Okay, sorry. I don't know how I got muted. So yeah, I'll just answer a couple of Shannon's questions real quick, just in case anybody else has similar questions. So regarding Shannon's question around the red line version, we are going to be putting out a chart that tracks what changes were made in the omnibus bill. Since we're doing a full repeal of that bill, full repeal and replace, there isn't a red line version because the first red line is the whole entire thing gets crossed out. And so, but Erica is working on a chart that we should have very soon to be able to track what changes were made and where you'll be able to find any language that was in the bill or in the ordinances before and where you can find it in the new language or if it's been removed or changed. And so hopefully that resource will be very helpful to you all and we should have it available pretty quickly. And then the only other thing I would say on that is I do think the major substantive changes are highlighted in the presentation. And so while there were the delivery changes and the changes around the cap and the lottery, there are some other changes that we made to sync up with the state that are pretty minor and just technical. But other things around like the hours of operations and things like that, those are all highlighted in the presentation from today. And so that's a good resource document as well. And if you find something that we didn't highlight that you think needs, some more presence, we're happy to go back and add that information as well. And then I think the final thing that I just want to address that Shannon brought up was around access to capital. And we did have lots of those conversations, Shannon, around options we could have to identify a funding source or a revenue source to provide grant or loan opportunities to social equity applicants. And we're not done with those conversations. We're still considering our options. It gets pretty difficult from a taxing perspective with TABOR restrictions and things like that in order to create a new fee. And so those are some of the things we're still talking about. And probably they wouldn't be necessarily requiring legislation if we headed in that direction. And we do want to be able to hopefully support and identify funding opportunities, or if there's legislation that would get state legislation that would give local jurisdictions funding to set up local grant programs for social equity applicants. That is something we obviously would be very excited about. And we did do the 50% reduced fees for social equity applicants, which, we're hoping that every little bit helps. So that's just one effort or one idea we had.
Okay, Joe Megacy is next. Joe, I'm promoting you to a panelist.
Hello, good morning, everyone. Thank you for the opportunity to comment here, and thank you very much for all the hard work that you've put into getting here. I have worked on home delivery legislation for good chemistry for 4 years, so I'm very excited that we're finally here at the home stretch, it appears. So thank you for all the hard work. I know this is not an easy process. But as always, Denver, I think, is a leader in cannabis policy and creates the best sort of regulatory market probably in the world. So thank you for all the hard work on that. And we are certainly excited to see delivery becoming a reality. I suppose there's a couple things I guess it somewhat would echo comments of my colleague Shannon Fender with Native Roots. We've been working on social equity for a long time. It's something that is important to our company. We work on it across several jurisdictions here in Massachusetts and the city of Worcester, Massachusetts. And yes, I think access to capital is one of the biggest challenges. And we are working, I think, at the state level with the governor to help secure some state funds for that. But I would hope that we can continue to explore the option of a local level fee. And that if the industry can support you in figuring out TABOR compliance issues around that. I think we would love to, dedicate some resources and time. Somewhat related to that as well. We're very much supportive of the exclusivity period on transporter licenses for social equity applicants. But what Aurora is doing right now is allowing the licensed retailers there to come online as well. And part of the reasoning in Aurora was to generate funds for social equity to address that access to capital issue. So I would hope there might be maybe willingness to consider allowing some of the legacy licensed brick and mortar retailers to come online at the same time to help achieve that goal. I think that would also help us achieve a goal of ensuring that we are providing a safe method as possible for our patients and customers to receive their products in these challenging pandemic times. We are the only industry that has been deemed an essential service that cannot meet our customers at their homes with our products. And we think hopefully there's a light at the end of the tunnel. It's very promising with these vaccines that are getting out in the public and the CDC's projections of that. But let's all hope and we get through this finally. But these next few months, I think, are going to be difficult. And so we really would like to provide our customers and patients with a safer method. And if there was be any willingness either, also, I would hope that the city could maybe consider bumping up the timeline from July, maybe to earlier, to help address some of those needs. I understand there's problems with creating a new license type, and it's a long process. I understand, but if we could move that up, that would be something I think our customers and patients would very much appreciate, and we would like to provide that. When we've surveyed our customers throughout this whole pandemic about our safety protocols, what makes them feel safe, and consistently they ask about delivery. That comes up as like one of the high end things that our customers ask for. So. And as related to the omnibus, I am looking forward to seeing sort of the chart comparison red line. That would be very helpful. I echo those concerns. So thank you very much for the opportunity to comment. We'll look forward to continuing to work with you in the city on this, and have a happy holidays.
Oh, thanks, Joe. And thanks for your leadership on this. And thanks for attending all of these meetings and being such a great partner. We really appreciate it.
Thank you.
Okay, next is AJA Palomino. I'm just reading your screen name, so that rings a bell. I'm promoting you to a panelist.
Hi, can you hear me?
Yes.
Yes.
Okay, cool. It's Asia, by the way.
Oh, I'm sorry.
No worries. I'm used to it. Yeah, so I just wanted to say this meeting has been super awesome. As someone who's been following this social equity program pretty closely, I'm really excited to hear everything that has been said and to get some clarification on a lot of these processes. I am a native in Colorado, so I've seen this whole industry boom and grow, and I'm super excited to be a part of it. And I think it's really going to open up a lot of opportunity for innovation and to open up that market share for a lot of these innovative products, and to really just give give that aspect or that part of the industry to really grow. I'm excited to see that. And I think that's exactly what's going to happen. I think it's really going to open up the market for consumers who have that stigma against marijuana to really be a part of this inclusive community. I mean, that's what marijuana is about. It's inclusive, it's beneficial. And I think a lot of that has gotten lost over the years, which is no one's fault, but it's just the way it goes. And I think this is really going to bring us back to where we need to be. Which is great. And I totally get where everyone's coming from as far as, you know, native roots and green, good chemistry, I'm sorry, as far as not, you know, having those barriers for them to deliver. But I think what this is all about is having some faith in some of these social equity applicants that we can live up to that as well. You know, we can deliver and we can have those new ideas that can benefit patients and everyone else just as well as they can if given the opportunity. So I think everyone should just like have a little patience, a little faith that this program is going to work the way it's intended to. It may not be what everything has been in the past, but I think it's going to bring something really great. And yeah, that's kind of my opinion on it. So I'm excited to be a part of it. And you know, also just going off of the you know, capital aspect. Just based on my experience, there are a lot of investors out there that are really excited to invest in this industry. Although it may not come from a state level, these investors, I think, have that same goal in mind of that social equity and the expansion and the growth of the market share and capital growth. So, you know, my comment on that would be maybe to, you know, invite some of these investors to these meetings so they have that opportunity to connect with these people who are, you know, new to the industry and new entrepreneurs and things like that. So, so yeah, thanks for everything today. I really enjoyed this.
Great, Asia. Thanks for your comments. Yeah, you're right. I mean, we do also think we're sort of on the precipice of some meaningful growth and some really big changes in the industry. So we're looking forward to that, and we appreciate your comments. Thank you.
Thanks.
Okay, next is Kristen Thompson. Kristen, I'm going to promote you to a panelist.
Hi. Sorry, just realized I needed to brush my hair. Thank you for the opportunity to comment. I put a lot of my questions and comments in the Q&A, and I'm sorry for the spate of them. I had a little PTSD from the battles that we went through with the city back in 2009 at the outset. I worked for a number of clients who literally had to move their shops because the city forced them into that. So my comments, I have a lot of them. I think part of it is, I'm going to start with, there's a lot in this omnibus bill and a lot that needs to be worked out. And it also has to go through the legislative process. And I don't know that our city council is fully prepared to have such a broad conversation about marijuana. I believe that we should separate the changes to the regulatory framework for existing businesses from the delivery rollout. And that would also help facilitate the rollout delivery, I think, faster. We could do that one first. And start having the social equity conversation and split it off from the new regulations that actually are cost drivers, even though we heard you say you want to limit barriers to entry. And that, I think that deserves two separate conversations. So on part of the changes to regulation, social impact plans, I think are great. And I'm not sure that making them public is such a wonderful idea, because a lot of it, while not in the city of Denver, does become important for our brands and for the acquisition of licenses in other communities. I also would like to point out in this area that the city, while asking us for our social impact plans and to talk about all the good that we are doing and making it searchable is not allowing us to put our brand on any of those social goods. And that is something that we have struggled with from the outset. That you can't, yeah, I know Tito's does all kinds of amazing work with animals, and because their brand is on dog food bowl, you know, food bowls that they give to bars that I walk by and let my dog drink out. If we're barred from doing that. We can't do it, and the city is perpetuating that by not changing, by not following what the state did around branding. I think that and I put in here, and I would like to have a further conversation about it, but what is the city doing other than controlling the marketplace for marijuana businesses, restricting what legacy businesses can do with our own brands, with our own products, while putting forward, moving forward on social equity? What is the city doing to take responsibility for what they did at the outset, for what its police departments did to these communities during the war on drugs, what the city did to the marijuana businesses at the outset that made it very difficult for many to succeed? Like I said, and I think most of you know this, I was one of the 2 lobbyists at that time. My client back then was Greenworks, which has gone through many purchases and now is the green solution. But these, I think, are broader conversations that I hope the city will partner with the industry to help resolve, rather than pushing that burden onto us specifically. My final comment will be that in House Bill 1234, there is a $1 fee on every delivery. And I know that, I mean, right now, this does not comport. I mean, that was before the social equity conversation started happening. Right now, that $1 fee is designated one. It's a nightmare for us to collect. I'm going to assume it's a nightmare for you to collect. But right now, that $1 fee is going to law enforcement. That seems to be completely in conflict with the intent of the delivery law in Denver. And so I want to offer that it is something that the Green Solution and a number of other businesses is looking at, is how to make that $1 go further and support social equity rather than law enforcement, which is the problem we're trying to resolve right now. So, so with that, thank you for your time and your consideration. There's a lot to unpack here. I know it'll be an ongoing conversation. I look forward to it.
Great, Kristen, thanks for your comments. You went a little over the time, so why that's okay. I think a lot of your points, I think, were addressed in the presentation, but let's get to some of the other people so we can make sure everybody has a chance to chat. And then once we get through that, maybe we can circle back on some of your stuff. Okay, thank you.
Okay, next is Dasan Hoover. I'm promoting you to a panelist.
Hi, can you guys hear me?
Yep.
Okay, good morning. How are you all doing?
Good, how are you?
I'm doing good. I appreciate you asking. I just wanted to kind of get on here and introduce myself. I've been in contact with Joy Pena over the last year through this kind of process that you guys have been going through. And I want to say that you guys have done a wonderful job, an amazing job, and I appreciate everything that you guys have put together. I think that I'm going to be one of the people that benefit from the social equity program. And I would like to actually address a lot of the different things that you guys put together, because I think the 50% is definitely going to help us with the capital So I definitely want to say that I appreciate that. And every little bit counts. So I know that even with the application process and maintaining your business, especially in this new industry, I want to say that all the help and the 50% is going to increase the amount of kind of influence and effect that we're able to have successfully in the industry, because I think going back to good chemistry and then as well as native roots, I think what everybody doesn't want is for us to implement kind of a foundation or a blueprint for how to operate delivery, and then we're having to stop it or put it at a halt because we're running into problems. So I want to say that you guys take the time that you need, go at your own pace, and I want to say that I support you fully. I also want to have one question. How can I support putting this bill into motion and supporting what you guys have put together? And then what is the timeline for it, so that I can kind of understand when I can expect to start to apply to be a social equity licensee?
Great, thanks for your comments, Dasan. You know, and you're right, all of these decisions that we made, including the 50%, there are pros and cons, but in the end, we felt like there were more pros on that than cons. Molly, do you want to kind of address some of Dasan's other comments, or do we want to wait, get through a few more people? I think we had a couple of that in the presentation as well.
Yeah, so I mean, I'll just say the timing is that we hope to initiate the city council process and kind of towards the middle to end of January, which would kind of get us to the end of February by the time it passes, but that's the targeted timeline right now. And then hoping for a July launch date. And back to a previous comment by Joe, that's as fast as we can get new licenses out the door, unfortunately. So if we're starting now in July, we've already started the development as much as we possibly can, and shooting for July.
Yeah, Dasan, thanks for your offer to support too. Eric, is that what you were going to weigh in on? We'll just, I'll let you share that information.
I was just going to say, and this is a good reminder to anyone on the call, that if you're interested in finding out more steps about the legislative process, for example, when we have a committee date or when it's going to be a council, and those sessions have public comments as well, sign up for our industry bulletin. If you're not sure how to do that, as Ashley mentioned, we did have a website migration, but it's on our website. Or you can reach out to marijuanainfo@denvergov.org, and we can always get you that link. We'll also be publishing information about how to apply to be a social equity applicant if the program passes, when that happens, through that bulletin. So that's a great resource for anyone on this call who wants to know more information about anything. And you can always email us at marijuanainfo@denvergov.org.
Thank you all, I appreciate it.
Thank you.
Okay, next up is Truman Bradley. Truman, I am promoting you to a panelist now. Oops. Oh, I'm sorry. Truman disappeared from my queue, and hold on.
He's back. I
Okay.
can see him.
He's back. Okay.
Hi, can you hear me?
Yeah.
Yes.
Thank you again. I guess we're just talking a lot this week. Couple of things. I'm not going to repeat what I said on Tuesday because I assume you guys already have that, other than to say thank you again for the hard work that you're putting in. I will say the industry was pretty surprised to see an omnibus bill come out. I wasn't aware that that was being contemplated, and the lack of a red line is making it really hard to understand exactly what changes are what. I think for folks who are not currently in the industry, they're looking at the big ones, but folks like me have to look at all of them. And so the sooner the better on that, please. I think also it's a little bit of a challenge as we are getting ready for the holidays here to be having the public comment without the red line and a week before Christmas, just because some people have already started moving on. So I am glad to see another, hearing that there's going to be another opportunity for a comment in January. I think that's really important. A couple quick hitters here. Back to the advertising. issue comparing it to alcohol. I guess the only other thing I'll point out is that it is currently legal to advertise for things like weed maps in the city. And so it does start to feel punitive in that the only people that can't advertise for marijuana in the city appear to be Denver licensees. And so, you know, it's just unfortunate. I did have a question about the new proximity measuring changes. Does alcohol have those same ones or not? And I know we don't have time to answer all the questions, but that's just one I didn't get to. But what I do want to talk about are renewals. Section 6222 of the omnibus. Again, I'm not sure what's new and what isn't, but I would suggest that the city consider 2-year renewals instead of annual renewals. I'm happy to pay the same in fees. It would just reduce the paperwork burden on y'all, and it would reduce the paperwork burden for licensees. I know that that may need to be a change that happens at the state level, and we're going to recommend that as well. Another thing is for 6222 subsection E around when renewals can be forced to go to a public hearing. These seem really broad to me. If I had a marijuana business and I was acting in bad faith, maybe I could report my fellow marijuana business, you know, my neighbor, and try to get them, you know, tied up in a renewal hearing or something like that. Both E1, E2, and E3 seem really broad. I'm wondering if other license types in the city have that same kind of language, and I'm wondering if it can be tightened. So for example, in E1, if it's, you know, how do we determine a threat to public safety? Some people think cannabis itself is a threat to public safety. And so, you know, is it putting another word in there such as significant, or is there a way to tighten that up? It just, I mean, we have a lot of faith in the current administration, you know, the folks on this call, but you never know, you know, the person who follows in your shoes may not see it the way that you do. And so it's just a concern. That's it. Thank you again for your hard work, and I'm sure we'll be talking again soon.
Thanks, Truman.
Okay, next, Jojo 2009 had your hand raised and then got lost in the shuffle. So I'm going to promote you to a panelist in case you still have a comment.
Hello, everybody. My name is Jonathan Salfeld. I'm the owner of Local Product of Colorado, which is one of the few remaining single location independent shops in Denver. First of all, I want to thank you guys very much for being so transparent and informative regarding these new bills. I had the pleasure of speaking with Joey Pena the other day, who was also extremely helpful. I share a lot of Truman and Kristen's concerns. We were around in the early days, and you know, it was a very difficult and often frightening process. And I'm not going to go over anything they said, but I'd like to bring up just a couple of points. One is the safe vault requirement. For a lot of us, we have very small shops, only about, you know, sometimes under 1,000 square feet like mine. The way that we've tried to secure product is by making our sales floor into a de facto vault that can be closed, you know, sealed when we're not in operation. To store all of our product in a safe, you know, or to somehow create a new room for a vault would be impossible. It's just the product is too bulky. There's too much of it. And of course, it would be extremely labor intensive to remove our entire inventory from the sales floor and store it. So I just wanted to make sure that, you know, we're somehow able for small shops to work within the new safe vault requirements. And secondly, and I spoke to Mr. Pena about this the other day, I was wondering about the off-premises storage, assuming that deliveries are permitted from the off-premises storage facility. I did notice that in the omnibus bill, there's sort of a gap where packaging is permitted on the state level in anticipation of delivery from off-premises storage facilities, while there doesn't seem to be any mention of repackaging at the off-premises storage facility in the omnibus bill, if we kind of look back at the off-premises storage regulations that already exist in Denver, any sort of repackaging is prohibited. So I was kind of wondering how those two things, assuming off-premises storage, delivery from off-premises storage facilities are permitted, how that would align with the city's regulation. That's it. Thank you.
Thanks, Jonathan. Let's, I think we might have a few more questions, and then we'll try to circle back if we have time to answer some of these great questions a lot of people have raised.
Okay, next is Kevin Gallagher. Kevin, I am promoting you to a
Hey everybody, Kevin Gallagher, Colorado Cannabis Manufacturers Association. I just want to echo the same concerns that I had during yesterday's meeting. Again, would really appreciate Denver opting into the branding regulations that have been allowed through Marijuana Enforcement Division. Again, I think if the state, or I'm sorry, if the city is making a good faith effort to lower youth prevention, that the city wouldn't just be specifically targeting cannabis businesses, that they would be targeting other entities as well, such as alcohol, right? Again, when we're just looking at branding, we're not talking about consumption. We're not talking about necessarily product photos. There might be companies out there that want to post billboards in terms of safe consumption, just like alcohol does, right? Not reinventing the wheel here. Or maybe they want to do good things around the community, and they want to, put an easy up with a brand, their branding on there. They should certainly be able to do so. So, if the city does have concerns in terms of, picture of product or what have you, right, can certainly build in those guardrails, right? But again, we want to be treated just like any other business. And again, if the city is making a whole-hearted effort in terms of really targeting youth prevention, hopefully it's just not our industry that's being unfairly targeted. Again, just want to echo the concern that the other gentleman just had in terms of putting product in a separate room or separate safe at night. That just simply is not operable for many businesses. Just want to echo that there are a lot of space issues when we look at dispensaries. Product, there's really not much room for it. And again, by virtue of that product having to be within a restricted access area or limited access area, there's already alarm requirements, video surveillance requirements, commercial lock requirements, right? These are already fortresses here. So really would ask the city to, strike that proposal and just let businesses store a product how they see fit under the current guidelines that the state has provided, which has been very, very successful here for a number of years. Again, really appreciate your guys' effort. You guys are doing a wonderful job, and really excited to work with you all further on. Thank you so much.
Thank you, Kevin.
Okay, nobody else has their hand raised right now. So if we want to go back to address anything, we can do that.
So Molly, why don't you just go ahead and lead on all those? Because I've seen you taking notes, and I know you've got all the answers at the tip of your tongue. And you're on mute.
I definitely don't have all the answers. So was it Jason or John that spoke before Kevin? What was the name?
Jonathan.
Jonathan. Okay, sorry. So just to mention or to refer to one of Jonathan's comments around packaging in off-premise storage, great comment, and that is something that we are considering aligning with the state on. It wasn't included in this draft of that we put out, because we wanted to actually take some internal feedback from both our Denver Police Department and our zoning department. And so if, you know, we're learning that it might not be a concern to allow for packaging and repackaging and labeling and those types of things in and off-premise storage. So we appreciate your comment, and we are considering aligning with allowing that activity in off-premise storage as the state has allowed. And then jumping to Kevin's comments, we hear, and several people actually mentioned this around requiring product to be moved and stored at night. And so again, we appreciate your feedback. This is definitely one that we thought we'd hear about, particularly from the industry. And so the concern is just that with the concern with keeping it the way that it has been is that we have been continuing to see burglaries, and there are businesses that haven't taken those precautions. And so, you know, putting it in as a regulation is one option, but we can definitely kind of go back and talk about how there could be an option for some flexibility in how to meet that type of requirement to ensure that businesses are being safe and putting their product in a safe place that could prevent burglaries, while also providing flexibility for the business based on their size and those types of things. So great comments there as well, and something that we will take a look at. The final thing that I'll just mention, and several people talked about this as well, was the mention of the advertising restrictions and the difference between marijuana and alcohol. So a couple of points on that, and I'm going to see if anybody else on the team wants to jump in, because this is definitely not my area of expertise. But we have more ability to put some regulations on marijuana advertising than we do with alcohol at the city level, and so that is one difference. And then also, I think it becomes very difficult when we're trying to compare those two between marijuana and alcohol regulations. For both advertising and proximity restrictions, it just becomes difficult to compare them apples to apples. They are equivalent in some ways, and in other ways they are not when it comes to both the type of substance we're talking about, the timeline of the regulations. Alcohol has obviously been around for a lot longer, and so those regulations have evolved, and there's federal level regulations, there's state level regulations, and so just those differences in how we're able to address certain aspects of marijuana differently than we are with alcohol. And so that just, for us, it's not an apples to apples comparison. So Erica or Reggie, I don't know if you want to chime in on that.
Yeah, I mean, I think that you're right, and I don't think I could say it any better, Molly. I think that there's always just been a myth of equivalency between the two of them, and depending on who you're talking to, some people might say regulate them exactly the same, but then others will say the exact opposite, right? Like cannabis is safer than alcohol. Like you shouldn't treat it the same way as a substance that is harmful. Like depending on who you're talking to, we can fall into a large argument. I think that there are policy reasons for why we do, or why the city can do or is doing what it is doing. Looking at it as a federal issue, a local issue, what the state is doing and falling in line, or trying to go a little bit further and trying to protect the neighborhood. And for the past, 5-6 years now, the city has been trying to play that role, and I think doing it pretty well. So we have to, as Ashley said earlier in the meeting, like we have to balance the issues of all the sides, from folks that are, folks like Smart Colorado that are like, we need to make sure that we rein this in, to the industry. And so we have to meet somewhere in the middle. And so we don't fall into the game of regulated exactly the same as alcohol.
Thanks, Reggie. As you guys know, Reggie's in the city attorney's office, and I think a lot of you on the call who've been here since the beginning are probably familiar and remember David Broadwell. Reggie trained under him and learned a lot from David, and David's really, the one who really, talked about that issue, that there, in a lot of ways, marijuana is actually regulated less restrictively than alcohol, not even having the federal overlay, not even having the FDA, not having the EPA to oversee it. And then in some ways it's regulated more strictly. And so we really we understand there's differences in the product, and we're not trying to force consistency where there doesn't need to be. We need to regulate marijuana based on the specific, both of the different characteristics of each of the products and based on the authority that we have. So thanks. We hear you. We hear people say that quite often.
And I will add too, I mentioned this on the call, on the feedback session on Tuesday. So for the sake of people on this call, I think it's important to note as well, marijuana has just been legal in Colorado for a very short time. And so in certain ways, we do look to public health data that we have as far as the impact of advertising and the impact of density and the impact of access on youth perceptions and usage of substances, whether it's cigarettes, whether it's alcohol, whether it's this new marijuana industry. And we just it hasn't been long enough to see long-term impacts the way we've been able to study those with cigarettes and alcohol. And so in those instances where we don't have that data yet because it hasn't been legal long enough, we do have to look and compare and see how those advertising, many of you mentioned that it's alcohol is much more loosely regulated when it comes to advertising. We look at the impact that has had on youth usage and perceptions about alcohol. And so we are trying to avoid any similar mistakes when it comes to marijuana. So I wanted to share that piece as well.
Okay, we have one more hand raised for public comment. Robert Gray, I'm promoting you to a panelist.
Hi, thank you guys for everything that you're doing. I think everything you're doing with the social equity is great and amazing. I just had one question about the restaurants. Who has to apply for that license? Is it the restaurant that applies for that license, or do they have to be a social equity licensee, or how does that work?
So let Molly take that question about the hospitality license and combining it with food.
So it would be if there was a social equity applicant that wanted to apply for it would have to be a social equity applicant that applies for the hospitality piece. If you're combining it with some type of retail food establishment, that would also be required. The license would be required for the retail food establishment, but there's no limitation on that license being owned by a social equity applicant or being applied for by a social equity applicant. So it could be one and the same person, it could be two different people, but the hospitality license would be a social equity applicant.
Okay, so the restaurant has to have a social equity person, and they have to have a hospitality license on top of that?
Any hospitality business that has like an underlying business activity, if there's a license that's required for that, so if it's a restaurant, if it's a, I don't know, something else that would require a license, coffee shop, something that would require a license, you need that license. That doesn't have to be a social equity applicant, but the hospitality piece would have to be a social equity applicant.
Okay, sweet. And does that include breweries also in these restaurants, or is it only people who sell food?
It can overlap with a liquor license, so.
Okay. So the restaurant wouldn't be able to sell liquor if they have the hospitality?
Correct.
Okay, sweet, cool. Thank you. I didn't know that. I appreciate it. That's all the question I had. Thank you for everything you're doing.
Sure. Hey, Robert. Also,
yes.
Joey Pena is our cannabis process navigator, and he or any of us can walk through some of these models with you because it does get complicated when you're trying to do the hospitality license and overlay it with another business and what you can do or can't do. And Joey's email. Joey, do you mind if I give your email, or would you like to do that?
No, absolutely. Yeah, it's just Joey. It's name. So I think you can see it there. It's Joey, Joey Pena. So it's joey.pena@denvergov.org. And feel free to reach out to me and we can add a little bit more, Robert. The retail food establishment stuff is something we've been looking closely at to try and really understand what that might look like. So feel free to reach out to me again. It's joey.pena@denvergov.org. And
awesome.
run through some things.
Awesome. Thank you very much. I greatly appreciate you, Joey.
Yeah. Thanks so much. Nice to meet you.
Yeah, my pleasure.
Okay, Jordan Wellington has raised his hand. I'm promoting you to a panelist.
Hey, everybody. Thank you very much for all the clarification and great answers to all these questions. I just wanted to mention and hope that it's helpful that I've spoken extensively to the Marijuana Enforcement Division, and we were really involved in the creation of the hospitality regulations and specifically about the overlap with retail food establishments. And if you haven't had a chance to talk to Dominique and the team over there about this, because we've kind of been through this exercise with them, it would probably be really helpful in understanding the interaction between those licenses, because there may be a kind of gap between the language in the city and what the MED is intending on how that could work. And so it might be helpful to just kind of talk through the way they read their regs and then consider whether that makes sense for Denver. That's all. Thanks.
Okay, there are not any more hands raised for public comment.
Great. And Jordan, thanks for that comment. And I've talked to the MED on that, but that does get kind of tricky with the retail food establishment. So thanks, everybody. I'll turn it over to Molly to wrap it up. A great conversation. We really appreciate all the input. Really helped to guide our decision-making and our recommendations. We appreciate it. Thank you. Oh, you're on mute, Molly. Yeah.
Keeps happening. Okay, so helpful feedback from everybody. Thank you. We really appreciate it. Keep an eye out. We'll probably be sending out a bulletin within the next day or so with that additional feedback session, as well as updated links to all of this information since because of that website transition. And again, email, contact any of us. We're happy to talk with you or come out or come to a virtual meeting of yours. And talk to any stakeholders that are interested in hearing more or just providing us with additional feedback. So with that, we'll close it up, and then we'll be compiling. We'll try to take, there was, some questions that were repeating themselves. So we'll group them all together from the Q&A and get something posted to be able to fully answer all those questions that were posted out there. So stay tuned for that as well, and we'll be in touch. So thanks, everybody.
One more plug too. If you have any written comments, we have a template that we'll be fixing the link to on our website. So that will be available for anyone who wants to submit written comments, either to go into more detail or reiterate something that was said today. We always appreciate that. So thank you.
Oh, good point. All right. Thanks, everybody.